Hello, I'm Sir Regina, and today we are talking about antenatal care. Antenatal care is the care that the mother is supposed to receive when they get pregnant. So we say the moment you realize that you're pregnant, make sure that you go to the facility. Don't wait for 6 months to elapse so that you can go to the antenatal. Remember, we talked about so many things that make us not to go in our menstrual periods. So when you reach the facility, make sure that you see a midwife so that you can get your antenatal care. In antenatal care, why do we do it? We do it in order to screen the high-risk mothers so that we can handle them appropriately with crucial care. For example, those mothers who once had hypertension, the diabetic mothers, the mothers with multiple pregnancies, and many others, as we shall see the abnormal cases. Then we also take antenatal care in order to take measurements to rule out if the pregnancy of the mother is thriving well. So if there is any deviation from those measurements, it means there is a problem. So the midwife has to take immediate action. So if you don't go to the facility, how will the midwife know that you're having a problem? We also take antenatal care so that you can get more health education talks about pregnancy, about what you'll do after you have delivered and what you'll do during labor. So this is why I'm saying go to the facility to get antenatal care. Go to the antenatal clinics. They are there in our country. They are everywhere. So please go for antenatal care. There are also some injections that they give or vaccines that prevent you from getting diseases like the tetanus, diphtheria vaccine. Those things are there. So today we shall talk furthermore on the measurements mainly. So why do we take the weight of a mother? The weight of a mother to be taken, it is very crucial. For example, if I came today with 50 kilograms on this visit and the next visit I have, like, let me say, doubled my weight, or I have tripled my weight. Let me say I have 50 today and the next time I come having 50, I come having 60. That means there is a problem. It means maybe I might be having a multiple pregnancy. A multiple pregnancy is that pregnancy where mothers have 2 or more fetuses within, or babies within their wombs. For example, you might be having twins or you may be having 3 babies within you. So that helps me to rule out if you're gaining too much. I'll find out why is she having more than 1 fetus within her womb. Then another thing, if you're not increasing and you're just decreasing, that means you're not having maybe a balanced diet to help your baby grow well. That means your pregnancy is not thriving well. So we find out all those things. That's why we take the weight. So if you have any other reason as to why we take the weight and you want to discuss about it, please put it in the comment section. Then another thing is the height. We take the height in order to examine the pelvis of the mother or the bones where the baby will pass to see if the mother will be able to push vaginally. There are centimeters that we consider that are supposed to be normal that we take so that the mother is monitored well during pregnancy. But though, yes, you may be having the normal height and yet you might have difficulties in delivery. So, for example, the mothers below 152 centimeters, but though don't get scared, there are those that deliver depending even on the type of husband that you're having. Yes. Like, for example, if you're having 150 centimeters and below, we take you to be a high-risk mother because your pelvis might not allow the baby to pass through. And then the size shoe, if you're having size shoe 4 and below, still, those are some of the things that help us as midwives to determine whether you can deliver normally. Remember, I also said it also depends on the husband you're having. For example, if you're a kind of person, for example, you're 152 centimeters and you're having a husband who is, let me say, 170 centimeters, your husband is having a size shoe of 7, then let us consider that. I'm not telling you leave your husbands, get the person that you love because that is who God created for you and he makes you happy. So those are some of the reasons as to why we take your height. Then we have what they call the blood pressure. We have the blood pressure. So when they take your blood pressure and it is deviating from the normal, for example, the abnormal one, when it is high from the normal, I'll try to put the figures in my comment section so that you can see. And if you can get a BP machine at your place, you can always take your blood pressure when you're pregnant, or you can tell your husband to help you out, or you can get any health worker who is nearer you to take it. And if it deviates from the normal, that person is able to help you. And if you're at home, please go to the facility. For example, if your blood pressure is high, that means you're having hypertension. And hypertension is one of the second killer diseases in pregnant mothers. So don't joke about it. It can make you have a swollen face, swollen legs, you swell everywhere, and people might think that you're having twins, and yet it is hypertension, or what we call pressure here in our country. Most of the people use that word pressure. So please make sure that when you go to the facility, they take your weight, your height, and the blood pressure. We also take the temperature in order to rule out the normal. If you're having a high temperature, for example 38.7 degrees, I'll put the normal values within my comment section. Make sure that you're handled very well. For example, like we had the COVID-19 saga. So when your temperature was high, that means we are supposed to find out, why is this mother having this high temperature? It may be malaria that is making you get that high temperature. It may be COVID, it may be a cough. And if you're not treated, remember, these organisms multiply in the body and you'll get other complications, and that is not what we want. Remember, we said we are preventing mothers from dying and having any other illnesses. So make sure that they take your temperature. And then the pulse. Here we are trying to see how your heart is beating. So still, if it is deviating from the normal, we shall find out the reason. And there are so many things that can make the heart to beat fast. For example, if you're not having enough blood in the body, if you're anemic, yes, that can also make your heart to beat very fast. So when you go to the facility, make sure that you take all these things, because antenatal is not only examining your womb to find out the weeks of the months of the pregnancy. It is not only to listen to the fetal heart, but all those things matter. And the next time we shall look at other things that also matter, like for example, the drugs that you're supposed to take when you have reached the facility. They are very crucial because some of them prevent us from getting diseases like malaria and so on. So next time, I expect you to tune in. Please like and share, because this information, we said, it helps us to prevent diseases and death within the pregnant mothers, those who are laboring and those who have delivered, plus the babies. Thank you for listening. God bless you.